Our study is going to be enrolling patients who have either a new diagnosis of a metastatic or advanced non-small cell lung cancer, a non-squamous histology, or these are patients who have had an early stage lung cancer who have unfortunately progressed. And will be a single-arm trial, so every patient enrolled in the study will be receiving the same treatment. Most recently, really in just the past year, we've had very exciting data that now for a lot of our patients, we should be using actually a combination of chemotherapy and immunotherapy in the first-line setting for this type of lung cancer. And they've had some pretty impressive results with patients having a much longer time before they have progression on this combination treatment. For our study, we're going to be building off of this foundation of a combination of chemotherapy with immunotherapy, and we're going to be also adding another agent, and this is called an anti-angiogenic therapy. The chemotherapy that we're using is standard chemotherapy for our non-squamous non-small cell lung cancers. This will be carboplatin and pemetrexed. The addition of immunotherapy is going to be using atezolizumab, and this is an anti-PD-L1 immune therapy directed target. And the last agent we're using is something called bevacizumab or Avastin, which is actually an anti-angiogenic therapy. The way that it works is to actually stop the blood flow to get to the cancer. Using this medication, it's actually going to stop blood vessels from generating and stop cancer from getting its food source, getting its blood source. The goal is to affect the tumor so much so that chemotherapy and our immune therapy can actually be delivered better so that it can attack the cancer more effectively, and also be something that can be tolerated very well by our patients. From everyone who starts the treatment, we're going to be measuring from day one. We want to find out how good our treatment is and how long it will last before cancer eventually starts to grow. The other goals that we're looking for are secondary endpoints. We look for overall survival. So of course we want to impact our overall survival of our patients, not just how long it takes them to progress, but we want them to live longer and want them to live better. The other things that we're measuring is we're measuring response rate of our cancer. So we want to hopefully have as good a response and as many patients respond to treatment as possible. But we're also going to be measuring for patients that just have a stable cancer disease. That's even positive for a metastatic lung cancer, that we don't want the cancer to grow or to spread. Last, we're going to be looking into what we call a correlative. This is trying to find other information from all of our patients and really to try to develop the best treatment we can possible, and also to tailor our treatment for patients in the future. The Cancer Research Consortium has been an amazing resource and has been extremely supportive of everything that we're doing, and really helping me to achieve my goals, which is helping my patients do better and trying to find the best treatments for them available.
This is a phase 2 study for patients with advanced non-squamous non-small cell lung cancer that will determine if the addition of atezolizumab to the standard treatment approach will increase the length of time your cancer is controlled. The usual approach to treating advanced non-squamous non-small cell lung cancer involves combination chemotherapy. Combination chemotherapy with a vascular endothelial growth factor medication called bevacizumab. Immunotherapy alone, or combination therapy with an immunotherapy drug. The purpose of this study is to evaluate if the addition of bevacizumab to a combination of carboplatin plus pemetrexed plus atezolizumab, an immunotherapy drug, will increase progression-free survival, or the length of time before your cancer worsens. About 46 people will participate in this study. Your immune system produces T cells to fight infections and diseases throughout your body. Some cancer cells have a protein called PD-L1, which allows them to turn off an attack from T cells. Atezolizumab blocks PD-L1 on the surface of cancer cells. This allows the T cells to remain active and attack cancer cells. The use of atezolizumab in this setting is investigational. Investigational means this combination has not been approved by the U.S. Food and Drug Administration to treat your disease. You may be eligible for this study if you have advanced non-squamous non-small cell lung cancer. There are other criteria that must be met to enroll in this study. Talk to your doctor to learn more. A full description of this study can be found at www.big10crc.org.